Let's switch gears now to the promise of testosterone therapy, myths and realities.
Yeah.
Why don't we start there?
I think first a great place to start is education. I get patients that will come into the office already on testosterone replacement therapy, seeking to continue or interested in, or thinking even better that that is sort of the answer to why they feel the way they feel. And the most important thing is to begin to educate that patient as to how you got this way, and of course to measure and get a baseline. So how do most men get to a situation where they have lower testosterone than normal, especially as we age? A lot of the theory comes from the possibility that body fat can affect your hormonal response to make and produce testosterone in a healthy fashion. So as we tend to gain in percent body fat as we get older, we can actually begin to sort of turn off our ability to make testosterone, and that's where the problem begins to come from. So if I have a patient that I feel has significant risk factors that is headed in that direction, I need to start to curb those behaviors so that we can help them lose weight effectively, and then therefore their testosterone can naturally begin to improve. And that's something that maybe they haven't been explained to before. In other words, what are the reasons why you ended up this way, and how can we begin to correct that?
We actually have a graphic on reasons for low testosterone. Let's look at
Sure.
that. Injury to the
Of course,
testicles.
some of those are obvious, obviously. So if there's injuries and there's testicular failure, or if there's removal because of a cancerous process, those are true hypogonadism, and those situations that may develop because of other diseases. But the bottom two are probably the two most common and most important there, where you have type 2 diabetes and obesity. And again, there's a hormonal feedback system that, as our body fat, male or female, make estrogen. So in the male, you have a high percentage of body fat, 30–40% body fat, and now that's feeding back into the pituitary gland and sort of beginning to turn off your ability to make testosterone, and that needs to be accounted for.
You mentioned hypogonadism.
Correct,
I wrote it down.
correct.
Just briefly tell me what that is.
So that's when there's a failure to, for the testicles themselves to produce testosterone because of the testicles either being small, or in certain cases, absent, of course, in genetic issues or whatever it may be, or because of a treatment, because of surgery or cancer removal, etc.